I met Clarence when I was 15 years old. We dated for 3 years. We were married. After we were married, he decided that he wanted to go become a physician, so we moved to South Florida and started a practice on Palm Beach.
So my dad's been a physician for 38 years.
I found him to be a very astute physician, and his patients loved him.
Just took a liking to him because you walked in, you sat down, and you could talk to him and he'd spend time with you.
He was very kind. He just had this look on his face that he really cared about what I had to say.
He was a loving husband, a loving father, and a great grandfather.
He's known as one of those vanishing breed of general practicing physicians that you just don't find anymore.
And then this COVID thing all started, and it kind of changed the atmosphere in the office. At the beginning of this, what we were told was fever, shortness of breath, and a dry cough. That was the symptoms that we were told to screen for. We hadn't seen our grandchildren or our children since February because he didn't want to bring anything home to them. Then on May 13th, he was diagnosed with COVID.
Told me that we needed to take him to the hospital because he wasn't breathing very good. So we helped him in the car. We got him to the emergency room.
I talked to him on the phone. He said everything was good. He had oxygen on, but his O2 levels were staying good. And then Thursday, they called and said he had been intubated.
Within a few days of being on the ventilator, every call we got, he was worse.
Everybody's heard on the news that it's not good if a COVID patient goes on intubation, they're gonna die.
And he was pretty much that whole 4 weeks, he was in an induced coma.
He received an experimental dose of medication that probably saved his life.
It was our hope that when he initially was released to this ventilator recovery unit, that within a few weeks, he was gonna be like every other COVID patient that you hear about. That's not what happened. He went into this facility, he spent weeks where we could go and look through the window and see him. I'd hold up pictures of his grandkids and he would smile and make faces.
Trying to give him some hope that his family was still there and we were rooting for him. One day he sees us and he has that expression that he knows who you are, and then others he doesn't.
While he was there, we continually saw his condition deteriorate.
He's suffering from severe muscular problems. He doesn't know where he's at. He doesn't know who I am. He doesn't know who my brothers are.
He doesn't know who his own wife is.
He has to have a nurse help him do everything.
And within a few days of being at that facility, we got a phone call saying he was being rushed back to the hospital again.
So it's been a roller coaster of his health and all of our emotions.
So the problem that we're facing right now, my dad's over the age of 65. He was on Medicare, and Medicare only covers so many days of a specific illness.
We're getting down to the limit of days where he's allowed to be in the hospital.
And if you don't get better, then essentially you become a self-pay patient.
We've tried to apply for workman's comp.
Because of the fact that my dad was serving on the front lines in the midst of a pandemic, treating patients, and the response that we have gotten is unless you can prove which specific person he saw that they had COVID and he got it from them, that you will be denied.
Stunned when I heard that in the state of Florida that we did not take care of the healthcare worker from a work comp standpoint. They were right on the front line.
Since COVID-19 was declared a pandemic, doctors and nurses have seen hundreds and thousands of patients.
The COVID tests were not 100% accurate. Patients had a 67% chance of receiving a false negative, which makes the burden of proof that much more unfair by putting it on our first responders.
The CDC, at the time that the pandemic was declared, had 3 symptoms. My mom and my dad were told there are 3 things that you need to look for. And they screened every patient that came in the door based on those 3 symptoms. And if they had those 3 symptoms, they were sent to the hospital to be examined, tested, and then maybe treated for COVID-19. On April of 2020, the CDC declared that there are now 6 more symptoms of COVID-19. To then be told that the burden of proof is to go back upon them to prove that patients they saw had COVID is nearly impossible.
He was out there on the front line taking care of all of these patients who were sick.
There have been studies performed that general practicing physicians like my dad and nurses who work in these facilities are at an even higher risk of not only getting sick, but of dying from COVID-19. They don't know what to expect. They don't have N95 equipment. They don't have PPE equipment.
We have a real possibility of them going into bankruptcy and losing what they've worked their entire lives for.
Reality is our state and federal governments have put up billions, trillions of dollars to take care of businesses in the middle of this pandemic. But yet when it comes time to actually take care of the medical workers that are taking care of us, many states have not taken any action to take care of those people.
We can't turn our backs on our doctors and our nurses and other healthcare professionals who take care of us every day.
We have a specific duty to take care of the doctors.
Dad's running out of time.
He's basically hanging on for his life.
If you go into war and you get your injured, you get your leg hurt or something, the VA takes care of you for the rest of your life when you come home. There's nothing here for doctors.
We are asking our doctors and our nurses to put themselves in the trenches.
And they need to be protected and taken care of.
So we know that our dad is not alone.
We know there's other nurses and doctors out there who've been affected.
We ask that you please contact us so that we can put you in contact with the people to share your story and make sure that the world knows what they're going through and find the care that they need.
We are calling on all government officials to solve this problem now, and we are asking the citizens of our great country to call your state and federal legislators and demand that they take action immediately.
We're all in this together.
Join the movement today and visit our website by clicking the link below.